The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. I'd like to ask the Premier three questions this morning about Medicare. First, about medication. Canada is, as we know, the only country with universal health care not to have a national pharmacare program. And this week, the federal NDP has introduced a universal pharmacare plan, which will save families, even those that have benefits, $500 a year, and save companies $600 a year. And so I want to address a simple question to the Premier. Does he support a universal pharmacare program for the people of Nova Scotia?
The Honourable Premier.
Mr. Speaker, indeed, all Canadian premiers have supported a national pharmacare program. I fully expect it to become part of the federal election. I know the current federal government has announced in their budget a catastrophic drug coverage, which we all know constituents and members of our own communities who, through no fault of their own, if they're ill, get caught sometimes with an exuberant bill that is just impossible for them to pay. This legislation will deal with that. At the same time, ensuring that we as a country, Mr. Speaker, enjoy the buying power that we can, and ensuring that we make sure that all Canadians have access to medication.
The Honourable Leader of the New Democratic Party.
A second Medicare question, Mr. Speaker. This one about dentistry in the mouth and teeth. We know that our private for-profit dentistry system puts a real burden on public health care because people often go to their doctor for tooth-related pain. According to a recent study in Ontario, the cost to taxpayers there is $38 million a year on this front. And if dental care were covered under MSI in Nova Scotia, we wouldn't have as many people in our province as we do today whose health, whose confidence and whose lives are seriously undermined by tooth problems that they do not have the income, the money to have seen to. So I want to ask the Premier another simple question. Does he support extending MSI to cover dental care for the people of our province?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. Mr. Speaker, we continue to support to ensuring that low-income families, Mr. Speaker, that no child should be disadvantaged from socioeconomic circumstances they are born into, whether it comes to pre-primary or the very issue that the Honourable Member is referring to when it comes to dental care. We'll continue to work with our partners to ensure, Mr. Speaker, that every Nova Scotian can have access to the appropriate dental care.
The Honourable Leader of the Official Opposition on his final supplementary.
And thirdly, Mr. Speaker, I would like to ask about mental health. No one can truthfully say that we don't have a two-tiered mental health care system in Nova Scotia, because we do. If you've got money or benefits, you can be seen on a one-on-one basis this week, maybe even today, at one of the private mental health services which are popping up all over Nova Scotia. But if you haven't got benefits or other insurance or the financial means, you face long waits, and there's no guarantee that there'll even be a one-on-one counselling relationship for you. So I want to ask the Premier, does he recognize that we have a two-tier mental health care system in Nova Scotia, one for people who have the means to pay and another one for those who don't?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank him for raising these very important issues, Mr. Speaker, that are facing Nova Scotia families today. The issue around mental health has been one, Mr. Speaker, that we as a government take very seriously. We continue to make investments in clinicians, but also, Mr. Speaker, continue to make investments in the wraparound services we're providing in our education system now, enhancing School Plus programs. One of the things that our expert panel, led by Dr. Stan Kuchar and Star Dobson, recommended to us that whatever decisions that we make, Mr. Speaker, needs to be evidence-based. But the Honourable Member raises the issue of timely access. We know there's more work to do. That's why we continue to make investments to ensure that we hire those clinicians, and at the same time looking at early identification of mental health issues, because we know our greatest success of ensuring and putting that individual back onto good health is by making sure that we do detect it early.